2022.
First of all, thanks to the Lasceann Comhairle for facilitating the discussion of this topical matter. The CSO recorded 2,892 victims of sexual violence in 2021, with roughly 80% of these being girls and women. For that same year, Women's Aid received 1,104 disclosures of sexual abuse, including 411 disclosures of rape. This is a specific and serious dimension of the epidemic of gender-based violence. Today I'm focusing on one aspect of this broader issue: sexual assault treatment units. It was revealed this week that there was a 25% rise in the numbers presenting at the 6 HSE sexual assault treatment units. This was the first year the figure was above 1,000. 1/5 of those were aged between 14 and 17. These units in Dublin, Galway, Cork, Waterford, Mullingar and Donegal do incredible work in treating and helping victims who arrive in a highly vulnerable state. They provide specialised care that is focused on the person. These figures underline their crucial role. Minister, based on the increase last year, I'm urging you to work with the HSE to provide additional funding and posts to support existing services and the expansion of outreach services. The outreach clinics in particular are essential. I know the Cork City unit supports recently opened clinics in Bantry, in my own constituency, and in Tralee. These are welcome developments and we need more of them. Minister, we can't tolerate a situation where, for example, victims of rape have to go 2 hours in a car before they get to one of the assessment units because, not to go into too much detail around it, but people can't shower before they have those assessments. And the further you are from those units, the more traumatic it is for the people travelling there. There's clearly an established need for these centres and for more of them. There's very specific work that needs highly trained professionals, and there must be investment to recruit and train more staff. This is a really complex area to discuss. Each and every incident is truly horrific and wrong, and it's important that when people experience these awful crimes and violations, that they feel they can turn to and trust our health services. It's also important to say that this is a health service that is separate to the Gardaí. Yes, they work closely with law enforcement, but no one is compelled to make an official report. It's a highly victim-centred approach. Professor Maeve Ogan, the National Clinical Lead for the HSE Sexual Assault Treatment Units and Consultant Obstetrician at the Rotunda Hospital, described the situation very well when she said, "If you're an optimist, you'd say more people know about our service, so hopefully the totality of sexual crime is not increasing and people are seeking care and seeking support and accessing that at a time and place that suits them and is responsive to their needs." Given that we know reported cases of sexual assault and rape are only the tip of the iceberg and that more people are attending these units, then more specialised centres will facilitate more victims in coming forward and getting tailored medical and psychological assistance. Minister, there's also a need to understand the implications of these numbers. As Professor Ogan stated, it is unclear if this relates to an increase in sexual assaults or reporting. We need a unified approach to understand the issues involving the HSE, Gardaí, violence support organisations and researchers. Related to this, I'm wondering if you could clarify when updated sexual abuse and violence in Ireland, known as the SAVI survey, will be published. This was commenced by the Central Statistics Office in 2018 and due for completion within 5 years. And I think it will be significant in shaping our understanding and policy development.
Thank you, Lasceann Comhairle. And I'm taking this question on behalf of Minister Stephen Donnelly. The Minister would like to thank you, Deputy, for raising this important topic. It's a terrible reality that sexual assault and violence continue within our society. The 2022 annual report for sexual assault treatment units in Ireland is yet to be finalised, but the provisional data for 2022 shows that approximately 1,050 people attended across the 6 units in Ireland. This is an increase of 191 or 22% over the 2021 attendances figure of 859. I note that the 2018 and 2019 attendances figures were almost identical, 941 and 943 respectively. The 2022 figure is showing an increase of almost 110 or 12% over both 2018 and 2019. This 12% level of increase over the 4-year period since 2018 gives us perhaps the most balanced view of trends over recent years. This 12% increase should be viewed through the lens of the work we're doing across the whole of government to encourage more victims to come forward to seek supports and to report these heinous crimes. Sexual violence is defined as any sexual act performed on the victim without consent. The sexual assault treatment units support people who have experienced rape or sexual assault, and they provide responsive and person-focused care for people aged 14 years and above who have experienced sexual violence. There are 6 sexual assault treatment units throughout Ireland located in Dublin, Cork, Galway, Mullingar, Letterkenny and Waterford. Each unit aims to care 24 hours a day, 7 days a week and respond within 3 hours. This is to ensure that people can access care in a timely fashion as set out in the 2023 publication, Sexual Assault Treatment Unit National Guidelines on Referral and Forensic Clinical Examination Following Rape and Sexual Assault. The sexual assault treatment units are geographically distributed to enable any patient nationally to access the service within a 3-hour window, optimising both the health and criminal justice responses to sexual crimes. The government has always been very clear that regardless of the circumstances in which sexual violence has occurred, a victim of these crimes can and should report their experience to An Garda Síochána. Victims of these crimes also have the option of calling the excellent frontline services provided by organisations such as the Rape Crisis Centre, which offer non-judgmental support, a listening ear and information. Their services are for both men and women, and the work that they do in this difficult space needs to be commended. The services provided by the sexual assault treatment units have 2 main components: the provision of health and supportive care and the collection of forensic evidence. Sexual assault treatment units are the key health sector supports available to victims of rape and sexual assault. Responsibility for responding to sexual violence is shared across government. Publication of the O'Malley Review Implementation Plan, supporting a victim's journey to help victims and vulnerable witnesses in sexual violence cases, and the work being progressed to the 3rd National Strategy on Domestic, Sexual and Gender-Based Violence launched last year further demonstrates the government's commitment to tackling the issue of sexual violence. Through the Supporting a Victim's Journey plan, a number of recommendations to support victims of sexual crime have been progressed. These include recommendations on the investigation and prosecution of sexual offences, the introduction of trained intermediaries, actions of training for frontline professionals, and actions seeking to reduce the delay in the trial process.
Thanks, Minister. I have no doubt that you understand the significance of this area, and I urge you to speak to the Minister about how the HC can develop increased capacity and geographical spread to deal with this horrific epidemic. I'd like to draw attention to the fact that the initial data shows 1/5 of those who attended the units last year, it's over 200 people, were aged 14 to 17. This is a particularly worrying number, and again, we don't know if this is an increase in rates of assault and violence or an increase of reporting, but regardless of that, it has to be a wake-up call. Unfortunately, we know that these figures are replicated in other findings. The National Women's Council of Ireland have highlighted that young women aged 18 to 34-year-olds in Ireland are twice as likely to be subjected to sexual harassment and violence than women on average. In all the government's efforts to address gender-based violence, there needs to be a clear emphasis on responding to these worrying levels among young women. Every time I raise these issues, my call for immediate reform of sexual and relationship education. Young people need to be properly educated on matters of consent and sexual health. It is that simple. It's blatantly clear that delays in these changes are facilitating harm. The debate is long over. We need those reforms now. Sexual assaults and violence at a young age will impact a person's whole life. We have to do everything we can to prevent these despicable crimes. There has to be specific integrated strategies involving health, education, law and youth organisations and sports clubs to respond to this issue. Nothing less than a whole of government response is required to effectively intervene.
Minister, to conclude.
Thank Thank you, Deputy, again for raising this important topic. And as part of concluding remarks, I'd like to refer to the Sexual Assault Treatment Unit Policy Review, which began in September 2018 and concluded in February 2019. The review examined the efficacy of these treatment units, and the review team comprised staff from the Department of Health, Justice and Equality, the HSE and the Sexual Assault Treatment Units. I'm pleased to say the implementation of the policy review recommendations have been completed. The 5th edition of National Guidelines on Referral and Forensic Clinical Examination Following Rape and Sexual Assault Ireland 2023, developed as an interagency document, and it ensures that clearly defined referral pathways exist so that all people, regardless of age, gender, can access appropriate individualised care that is responsive to their needs. The implementation of the Domestic, Sexual and Gender-Based Violence Strategy 2022 to 2026, as well as the completion of a range of other projects across many government departments, will be essential towards achieving the aim of reducing sexual crime. Responsibility for responding to sexual violence is shared across government. I'm aware that the Department of Justice has agreed with the Central Statistics Office to the development and delivery of a significant new national survey on the prevalence of sexual violence in Ireland. It will look in detail at the experience of sexual violence and abuse for both women and men in Ireland. Having the most relevant and up-to-date data on the prevalence of sexual violence will continue to help us to plan for better services and supports for victims, including across the sexual assault treatment units. Thank you.